put that on the last one.
Yeah, so like we could
I'll let you know.
Thank you so much for being willing to do the presentation.
Thank you for the invitation.
When this gets all done with, we're going to need to talk about consultation groups for the Psy.D. Jurgen suggested that you might be willing to facilitate some of that. And I'm wondering if you might even be willing to I don't know if I'll be able to do one, but I want to run two.
Yes, my gut reaction is yes, of course. More so it depends on what my boss will allow me to do with my time.
Who are you working for these days? Is it Jamie?
Yeah.
Okay. Well, at least she's bought in.
Yeah.
So we'll have to chat about it and see what the possibilities are.
Happy to. Thank you for considering.
I really am grateful that you're working.
Yeah. I'm excited about the opportunity to do it. It was great when I was in insurance, and then thereafter, when I was able to jump in.
And that's exactly what we need.
Yeah.
I better run to break away.
Thank you. Thank you for remembering.
spread it.
Yes, I am. Thank you.
Sorry, Tony. I'm going to see where which they separated.
Yes, she's ready.
Sit right here.
A lot of people are.
She feels like if I get kind of like the actual treatment center, like teaching instead of then no, right?
Throw my body across.
And then I'm just sitting back and
Oh, you're not.
okay. What about it?
So I told Sarah I'd buy her lunch.
All right, you guys, if there's any empty seats, can we move towards the wall so I can see how many more people we can let in? One there? So- Is that an empty seat? There's room to the bathroom. Okay.
Okay, are we good to go? Mic check. Are we good to go?
All right then.
Shannon, or Dr. Cayer, we do want you using the mic for the live stream.
I just apologize for all of you on the receiving end of this. I'm recovering from a cold, so I'm very nasal. I apologize again. But hi, my name is Dr. Shannon Cayer. I'm a psychologist at Wasatch Behavioral Health. And the topic of compassion fatigue is really important to me given our line of work, whether you work directly doing therapy or psychological testing with our clientele, or if you are a support person at the front desk checking them in when they're really irritated and not trying to listen to your efforts of customer service, we are all going to be a little bit exhausted from our work. And so the idea of compassion fatigue first became noticeable to me in 2017 when I was working at a therapeutic program at a high school. And I noticed, clientele very similar to the adolescents that we treat at Wasatch. I noticed some of the teachers, where I was a clinician, really using this language that was similar to the language that our clients used, our students used. A lot of whom had experienced trauma in their lives, a lot of whom had hopelessness. And so I was like, are we also experiencing that too as the staff, as the health people? And the answer was yes. So that's when I really started to dive into this topic. And what I have passed out to you all is the ProQual, the Professional Quality of Life. It's a survey, and I encourage you to take it. I administer it most times when I do a presentation like this, just to help people get a almost objective understanding of where they're at in terms of their compassion fatigue, burnout, and secondary traumatic stress reactions. You don't have to share your results with anybody if you don't want to, but there is a self-scoring instructions there and ways to interpret your scores. And if anybody would like to talk about their results at a later date, I'm happy to go over them with you. These are our objectives. We'll talk about traumatic stress, compassion fatigue, and burnout, and discern between all of those concepts. We'll talk about organizational themes and contributions to these undesirable experiences. We'll talk about self-care, and we'll briefly talk about how COVID-19 has perhaps influenced our susceptibility to compassion fatigue and burnout. And I will briefly go over some Wasatch behavioral health resources that are put in place to potentially prevent or help you manage your burnout and compassion fatigue. So this is kind of the underlying idea of this whole concept. Put your own oxygen mask on first. That's what they tell us on airplanes, because what good are you to somebody you are trying to save if you can't breathe and therefore die? You know what I mean? So there are a few types of traumatic stress. A lot of these you can probably remember a client or 2 or 20 telling you about. What we're going to be focusing on is particularly this, my leftmost, your rightmost column. And this is a low intensity activation, continual environmental activation. And so that could be caregiving for a sick family member, working in the mental health profession with trauma survivors, spending many hours with individuals who have severe behavioral or emotional disturbances, repeatedly hearing about or witnessing horrific incidences, as in the lives of dispatchers and EMTs. And so kind of under this umbrella, you can see experiences of vicarious trauma, secondary traumatic stress, and burnout. I really like this quote. Caring people sometimes experience pain as a direct result of their exposure to others' traumatic material. Unintentionally and inadvertently, this secondary exposure to trauma may cause helpers to inflict additional pain on the originally traumatized. I like it, even though it's really doom and gloom, because it sums up the importance of what it is that we need to pay attention to as service providers. It's not fluffy and it's not really nice, but it's pretty accurate because we have a lot of ability to cause harm to our clients, especially if it's inadvertent, and so hopefully throughout this presentation, you'll be able to gain some insight into perhaps blind spots that maybe you already have, with the goal ultimately to take the most care of yourself to therefore provide the best service to our clients. Figley is a researcher who primarily focused on secondary traumatic stress in its early stages, and he said, we feel the pain literally of others. And his work started when working with families who had family members come home from the war. So to summarize what compassion fatigue is, because I recognize I've been throwing around a handful of words here: compassion fatigue, vicarious trauma, secondary traumatic stress, burnout. Compassion fatigue is synonymous with secondary traumatic stress, and we'll get into why that is. So Figley defines compassion fatigue as the natural consequent behaviors and emotions resulting from knowledge about a traumatizing event experienced by a significant other. It is a stress resulting from helping or wanting to help a traumatized or suffering person. And then Bride later said that compassion fatigue was the observation that people such as family, friends, and human service personnel who come into continued close contact with trauma survivors may also experience emotional disruption, becoming indirect victims of trauma. Around that same time, LaRoe said the compassion fatigue is the result of unconsciously internalizing and freezing traumatic emotion into the very cells of your body as memory. So we've learned over the years of research that compassion fatigue symptoms can mirror direct exposure to trauma and can be referred to as secondary traumatic stress, as I said. And those experiences can include intrusive thoughts and images of that other person's trauma, avoidance of stimuli that remind you of that person's trauma or cause a similar emotional reaction, and physiological arousal, that hypervigilance or that irritability or that lack of concentration. We might also notice negative emotions and thoughts towards the survivor. We might also then, in terms of trying to avoid or perhaps for unknown reasons, notice an increase in substance use, interpersonal aggression, and social withdrawal. Merriman described compassion fatigue in mental health professionals as an occupational hazard, which I think is really fascinating. So this is Figley's process of compassion fatigue. So how do we get from 1 to 10, right? Well, we are going to start by being exposed to suffering. That's what we get paid to do, right? We show up to work and say, what is your suffering about this week? And how can I help take it away, right? We are taught time and time again to be the most empathetic person in this person's life, right? To help them with this suffering. And we elicit, it's very naturally concern is elicited from us. That's why we're in the helping profession, is my assumption of all of you. And then we have this response, right? We have this empathy, and then we want to do something with it, right? We want them to know how much we are experiencing their suffering, because when they're, not alone anymore, when they feel safe to go there, we want them to go there. That's where the healing happens, but that means that we're allowing them into our space. So what we need to then do is ultimately detach from that person's experience as if it's not our own, because it's not. But sometimes it's difficult to do. And a lot of times we experience a sense of satisfaction from helping, right? Not only is it extremely gratifying to help somebody through a really difficult event that occurred in their lives, it's also really satisfying and gratifying to get paid to do it. So we like, most of us, I'm hoping, going to work and putting ourselves in these situations that are troublesome for us. So then we have this residual compassion stress, right? I saw 6 clients today, and wow, that was a lot, and no one has it easy. And now it's 5 o'clock, and I'm getting ready to go home. So I should just be able to, if any of you were just in Janine's presentation, she talked about putting it in her backpack and leaving it at the door when she walked through the door, right, when she got home from work. And she found that comical because that wasn't really the most effective for her, right? It's not that simple. We can't just put it in a backpack and leave it at the door at the end of the day. And then we do this for days and weeks and months and years. And then we start to develop reminders of our own traumatic memories if we've had any, or we build up so many memories from our clients that we start to have a catalog of them that kind of come to the surface pretty easily. Not to mention, we are more than just mental health professionals, right? So we have other life demands that can make the processing of these vicarious traumatic experiences difficult. So all of that can end up in the idea of compassion fatigue. Does anybody have any questions about that process? So I found it really difficult to fit in all the information that I wanted to in this presentation because we could really talk about it for days. So part of what I want to provide to you is education, but I want to also try to provide you with a lot of tools to prevent and overcome compassion fatigue and burnout. So one way to help manage the consequences of compassion fatigue is to try and turn it into flow, which is an attempt to find opportunity to better channel compassion fatigue, right? Okay, so flow is a condition of mind and body that we experience when the mind and body become so connected that we get lost in the zone. So the way that flow was originally described to me was that sweet spot between like effective and confident and I got this and I know how to do this and challenged. Has anybody experienced flow lately? Because it feels really good. All right. I hope you experience it sometime soon because that is when we are actually like at our best as employees. And so when the frozen energy of compassion fatigue is absorbed and internalized, that energy accumulates and can exacerbate problems, or we can discharge it through mindful breathing and movement. And mindful breathing and movement can transform energy residue into flow, and that's where we are at our peak performance. So now talk about burnout a little bit. This word is thrown around all the time. Happy to provide you with some definitions for it. One definition is this psychological syndrome characterized by energy depletion, increased mental distance from one's work, and reduced professional efficacy. That's through the World Health Organization and the ICD. Radenska, just last year, defined it as a significant psychosocial problem that is caused by unsuccessfully managed chronic stress in the workplace. Maslach, who is like a burnout HBIC, says burnout is a response to chronic interpersonal stresses on the job. And then Maslach continues to educate us that there are 3 main components, right? This overwhelming exhaustion or feeling depleted of one's emotional and physical resources to carry out work demands. Feelings of cynicism, so indifference towards work and detachment from the job to gain distance from exhausting work demands. And 3, sense of ineffectiveness or inadequacy at fulfilling job responsibilities. My assumption is when you're feeling particularly exhausted and cynical at work, you aren't thinking that you're like the best therapist on the floor, right? So all of those 3 things kind of go hand in hand and can bounce off of each other and make each other worse if we allow it to. And Figley says that burnout is partially due to one's ability to empathize, one's actions towards a survivor, one's inability to escape relief from their actions through disengagement, and the sense of satisfaction one gets from helping the survivor. Moreover, Burnout can lead to less effective patient care and make providers less likely to use evidence-based treatments, according to Maslach's research. Providers who use evidence-based treatments experience less burnout, according to some research. Evidence-based practice use, evidence-based treatment use yielded a positive correlation with professional efficacy in one study in 2014. And it was predicted by younger age of the provider, lacking specialty training, high caseloads of individuals with PTSD, and lack of evidence-based treatment use. In community mental health research, age has been negatively correlated with secondary traumatic stress, meaning the older you get and the more seasoned in your career, the less likely you might be to experience burnout. And in university counseling center research, perceived increases in in caseload severity was positively correlated with burnout. So evidence-based treatment use was negatively correlated with burnout, and perceived divergence from evidence-based treatments were positively correlated with burnout. So in other words, as university counseling centered counselors perceived their caseloads to either get bigger or get more intense in terms of severity, their propensity for burnout increased. And then with the increased use of evidence-based treatments, propensity for burnout decreased. And then with divergence from or deviation from evidence-based treatments, burnout was more likely. Here are some of the manifestations or experiences one might have when experiencing burnout. And when I show people some of these items, they are a little bit surprised at how in your face some of them are, how common some of them are, how many, I feel, how many my partner feels and experiences, because I think some of them can go overlooked, or maybe there isn't a direct noticeable correlation to burnout and compassion fatigue. But if we take a second, we can kind of clearly see why some might be related. For example, absenteeism, wanting to come into work late or call out of work more often or take more days off. While it's super important to listen to what you need, right, in terms of some rest and some breaks from work, if you are more calling out kind of at the last minute than usual, maybe it's a time to take a minute and look at what your job demands are and how you're managing them, and talking with your supervisor about that. If you're noticing changes in emotional reactions, perhaps it's more difficult for you to experience happiness and pleasure at work, that might be something to look at. Or if you're feeling more overwhelmed than usual, or if you're feeling more hopeless than usual, or if you're struggling to concentrate, or if you're dreading working with certain clients. Like I think with this idea, it's almost comical, right? Because it's like, well, of course we deal with clients that we don't necessarily want to work with, or we get fatigued by them, but that's not, I don't think that should be the norm, because what is the consequence of that? We can kind of chuckle about it as providers and commiserate together, but what is that client experiencing? We don't want to just brush these things off. Or if we are constantly in self-doubt or feeling ineffective, if we are more exhausted than usual, maybe that 3 o'clock fatigue starts to be experienced more like 10 a.m. These are things, you know what I mean? 3 coffees a day is too much. We can also notice enmeshments between social and professional life, which becomes increasingly more difficult when your social circle is at work. Am I right, ladies? Right? That's what I'm saying. We are at work together, struggling, and then we leave work and go to dinner or go to do whatever, and then we talk about work and the stresses at work, which, while misery loves miserable company, we may not be helping ourselves or our clients in the long run when we do this. Notice too the differences that occur maybe at home. If you're having a reduced sexual intimacy, you're drinking or smoking more frequently, or you're having more anger outbursts at your partner. So there's some research about organizations and how organizations and their structure can contribute to or prevent burnout. And so I'm just going to go over a couple definitions for you. Organizational culture is the modeled and observed organizational norms, beliefs, and expectations that are taught in staff. A huge desirable factor of Wasatch Behavioral Health, you hear all the time, is the culture, right? We have a wonderful work culture. The psychological climate of the organization is the individual's perception of whether or not one's work environment is personally good or bad for their own well-being. The organizational climate is the shared perceptions of the psychological climate. And the psychological and organizational climate lead to burnout as they influence the staff's perception of how valued and supported they are by the organization. I'm sure we've all worked in places where they haven't felt particularly supported by their workplace, and I bet that was not your favorite place to work. I bet you felt ineffective at that job, or I bet you felt like your work didn't matter. I bet you felt more tired. Invalidated, yes, totally. And that's not the kind of environment that is going to prevent compassion fatigue, especially with the kind of work that we do. Some unhelpful organizational themes are, for example, when staff believe that they can't discuss cases at work that cause them trauma or anxiety or abnormal reactions because they'll feel like they are going to be perceived as wrong or untrained or uneducated or weak or overworked, right? Maybe some of those things are true. Maybe more training does need to occur. Maybe they are overworked. But the fear of the consequences of those potential labels shouldn't keep us from acknowledging them. And that kind of avoidance of that acknowledgement is what causes us more harm. So if any of these things do occur, it's my hope that y'all work in a workplace that is going to be supportive if you do disclose some of those experiences. Another common unhelpful theme is when staff cannot discuss cases outside of work due to confidentiality standards, which is in the case of our work, which make things really difficult. Therefore, staff does not receive necessary social support, or two, staff tends to rely heavily on each other for emotional support, like I was saying. And there are ways to overcome this barrier. We can't necessarily go home and say, Suzanne did it again, she relapsed, right? That's super unfortunate. What we can do is go home and say, it was a tough one, someone I really cared about and have been working closely with relapsed, and so if I'm a little bit agitated, please don't take it personally. I'm working through it. And then using supervision in an effective way to deal with that case. Okay, that way you're getting the emotional support you need, for example, from your family member who isn't going to then lash back out at you for acting a little bit agitated, but you're also going to receive the support you need from a qualified person, somebody at the workplace who you can really dive into the details with. And then finally, this is my least favorite one, when staff wears overwork as a badge of honor to imply that they're willing to sacrifice in order to avoid negative perceptions of colleagues. You hear it all the time. Oh, I was in the office till 9. I worked 6 days last week. I got this much overtime and I'm just exhausted, but gotta work, right? Gotta get it done. And I'm doing so many things. Like, that's wonderful, whatever you're trying to validate for yourself. But honestly, this type of narrative is so detrimental to the workplace, because then what does that say to the person who is meeting their contract and working 40 hours a week and doing great work, and maybe not feeling as overwhelmed as you, the overworker, the sacrificer? Are they going to feel like they should start overworking themselves to be at your level? The hope is no. The hope would be if a colleague is talking to you about how much they're being overworked and how much they're sacrificing, that they would meet you at your level, like a healthy level. And that would really be a strong encouragement of mine to promote to your colleagues. I'm sure we've all been exposed to somebody who acts this way, right? It's not a great experience for anybody involved, the recipient or the person who's saying it. There we go. Okay, so I'm going to dive into the idea of self-care a little bit. So there are some organizational assumptions that a company can take to promote employee resilience. I was going to say resistance, resilience. So we would hope to receive from our organization the assumptions that staff are competent and psychologically healthy, that compassion fatigue is an inherent risk in a workplace like this, that compassion fatigue is not your fault, not the staff person's fault, and that organizational self-care is most effective when all departments are on board. I think our company has promoted this today in itself by asking me to speak here, and which is basically validating that we are all at risk for compassion fatigue and burnout, and that hopefully with this opportunity, you're able to learn how to prevent and overcome that if possible. Two primary goals of organizational self-care include supporting staff and supporting the continuity of organizational functioning. Figley informed us that sense of achievement is a major factor that influences compassion fatigue, which I'm sure we can all relate to, right? If we try really hard at something, try to develop a new skill or a new knowledge set, or try to maybe work in a new role, we are going to be more likely to feel exhausted, burnt out, detached from our work if we do not have some successes under our belt, right? If we continue to have failures and mistakes, we're more likely to stay lower to the ground. It's hard to continue to pick yourself back up time and time again. So if you can find in any of your work, even microscopic achievements to remind yourself and to praise yourself, that's really going to help you, especially if you're in a position or in a role that is difficult for you, or maybe that's new to you. Look for the small achievements. And then the organization must be enable staff to take steps towards preventing and managing compassion fatigue. Self-care is an ethical issue, I would say, for most mental health providers. It is particularly outlined in the ethics code that we have as psychologists, that we need to pay attention to this in order to provide the best treatment possible. So our practices can be equally rewarding and stressful, right? I've never heard a truer statement, I don't think. And so briefly, stressors are what activates the body's stress response, which can be internal or external. And then stress is the neuro and physiological shift in the body when encountered with threats or stressors. So mental health professionals are susceptible to a unique kind of organizational stress. We have extensive client contact, behavioral monitoring, interactions with family and other supportive members, significant flexibility in identifying appropriate treatment strategies, and urgency. Discerning when stress converts to impairment is super challenging in the moment, and you might have to rely on your supervisor or boss or manager or trusted colleague to help you see maybe when you're moving into that impairment zone. Some proactive approaches to self-care. Proactive approaches to self-care can mitigate the effects of stressors on professional competence. So dealing with stressors does not necessarily equate to dealing with stress. It is so important for us to complete the stress response cycle, which starts with a perceived threat, becoming activated, and then acknowledging our survival and relaxing. That is the completion of the stress response cycle. But going back to my example of I just saw 6 clients today, all of whom are having a really difficult time. And then it's 5 o'clock, so I'm gonna hop in my car and go home. We didn't complete the cycle. We just acknowledged that was really hard and I'm sitting with a lot right now. And that's not necessarily enough. So while we can't always eliminate the stressors, we are not built to stay stuck in that survival mode. We're not built to stay in that stress response cycle. We have to complete it in order to really stay healthy, because this kind of stuckness in the stress response cycle can cause, detrimental health effects and really deteriorate the level of our work. So you may see it difficult to do self-care or to feel effective as a mental health provider if we are lacking personal accomplishment, if we are engaging in overcompensating efforts to save clients, if we have continual boundary violations, if we feel powerless, if we're not recognized or supported for our own grief responses. For example, if a client dies or a client you've been working with for so long just got their children taken away from them again, we are allowed to grieve those experiences, and it's so important for us to do so, right, and complete those cycles. A lot of times too, clinicians can experience moral distress because we lack professional control to do what we believe is right. We work in a system, and sometimes our ideal way to help the client isn't what the system can provide for us, and that gets really difficult over time. Some of our the difficult situations we deal with, like chronic suicidality, self-harm, victims of abuse or assault, coping with the death of loved ones or their own fatal disease, aggressive or homicidal episodes, abusive partners or former partners that pose a risk to the client's safety or our own safety. These are not topics to be taken lightly and to just sit in your office at the end of the day after you close the door, right? Those are things that we take home with us. I've had many conversations with my colleagues about our own personal feelings of unsafety and thinking about, at 9 o'clock at night when I'm walking to my car door from somewhere else way after the workday, thinking about a client's violent husband. That's not something you can just let sit in your office as you go home and live your happy life after work. So it's so important for us to deal with those issues head on. That is how we prevent compassion fatigue and burnout. More so, why self-care is so important in terms of maintaining ethical practice. You have to think about that ethical decisions require maintaining an appropriate balance between personal and professional boundaries, right? And sometimes our worries may compromise our competency in making therapeutic decisions. So if you are burnt out, hypervigilant, having a hard time concentrating, anxious, and maybe even a little bit more irritable than usual, is this really the mindset you want to be in when you're making a really important ethical decision for your client that might impact them in the long term? Probably not. We want to be in our best mindset for them. This idea of the wounded healer, has anybody heard about this concept? It basically explains the emotionally charged therapeutic contexts that can lead to unique professional growth, right? We may have emotional experiences working with clients that serve to enhance our therapeutic endeavors, right? Revisiting the idea of post-traumatic growth. So while our clients have really difficult experiences and histories that they share with us, that doesn't mean that we're destined to be burnt out and vicariously traumatized for the rest of our lives. We can take that information and learn from their experiences and relate to them on a really intimate level, which can therefore change our lives for the better or improve our lives, broaden our worldview and help us understand what other people might be going through that we're working with. But if we don't manage the difficult parts of that simultaneously or beforehand, we're not going to get to that place of post-traumatic growth. We're not going to be able to get to that place of enhancing our practice and enhancing our worldview if our worldview then becomes the world is a threat. Nobody is safe, right? Everybody's dangerous. So we might be missing out on really wonderful personal changes and changes to your practice if we don't do the difficult parts too. Relatedly, you can't see it that well. This philosophy of the healer warrior says that it is a marriage of martial arts insights and research and scientific outlooks of professional caregiving, okay? So it includes 3 components: self-honesty, which is a process and skill set that is necessary to cultivate insight, and it allows you to develop the ability to suspend judgment and pause your script. Personal responsibility is the continual willingness to own your personal experience, surrender the need to be right, look, listen, and let go. And self-expression, the action of clearly tuning into you, the connection between mind, body, energy, emotion, intuition, and insight. Similar to put your own oxygen mask first, I say this time and time again, you cannot pour out of an empty cup. You must fill your own cup first. Does anybody use this simile in therapy? Right? All the time. Actually, compassion fatigue and burnout is something that sometimes people come to see me for therapy for, because it is truly that much of an issue outside of even our own workplace, that people have a hard time managing on their own. So my encouragement is to enhance your self-awareness in the workplace, perform regular check-ins on your emotions and monitor your responses to clients and your daily responsibilities. Sometimes we have to work harder to avoid burnout because we have those outside stressors, things going on at home, environmental problems such as a global pandemic, for example. Self-reflect and identify triggering patterns that cause you stress. Maybe after a year of practice, you realize 50-year-old women really put me in a bad mood. Maybe it's time to talk to somebody about your mom issues. I don't know. Reach out for additional and necessary social support, like delegate tasks at home, use employee assistance programs. Like I said, you can go to therapy about this and learn about compassion fatigue and prevention, which you're already doing. In Janine's presentation, she mentioned using supervision to prevent burnout and compassion fatigue, which I was really excited about. It's probably the most important resource to help you with this problem, preventing it and managing it. So I encourage supervisees and supervisors to really make this as a regular discussion, maybe at least once a week, at minimum once a month, bringing it up and saying, how are you handling everything? How's it going? Not how are your clients doing, but how are you doing? And what can I help you with? And if the supervisor doesn't facilitate that conversation, maybe it's time for you to bring it up. So you can do this by debriefing when work feels unmanageable or when time management is difficult. When supervisors discuss and educate about compassion fatigue and promote protective factors like self-care, struggles become normalized and preventative skills can be enhanced. Supervisors should model and mentor self-care habits in supervisory relationships. So it would be not helpful at all if a supervisor had that awful, unhelpful assumption that I shared before of overworking and sacrificing yourself for the job. That's not going to be helpful in supervision. No, we want our supervisors to model how to recognize what's going on with yourself, how to acknowledge what you're experiencing in reaction to a client, how to manage those difficult experiences. And advocate for what you need as a supervisee, an employee, and as a human, right? It's our job. Don't forget that you have influence over whether your needs are heard or met. We can't assume that our supervisors will be able to pick up on our nuanced reactions to stressors. So if your supervisor doesn't bring it up, I encourage you to. I'm only going to briefly talk about COVID-19 excitedly because things are different than they were about 8 months ago. But Festival and Chernus, who I will primarily be citing because they published this great article last year, they said having a robust toolbox of practices that resonates with you can be a helpful resource in navigating expected and unexpected challenges. And I love that because they say that resonates with you, because I'm going to give you a whole slew of recommendations on how to manage compassion fatigue and burnout, how to prevent it, how to enhance self-care, and all of them might resonate with you or none of them might resonate with you. It's up to you to figure out what's best. And your self-care strategies might change depending on what's going on in that moment, on that day, with the weather, in the setting. So I encourage you all to be varied with your toolbox. Radenska and colleagues in 2020 mentioned that while workplace burnout was already apparent, particularly evident in healthcare settings, nurses and social workers usually have the highest rates for compassion fatigue and burnout. The uncertainty of COVID-19 has exacerbated a lot of already experienced burnout symptoms. What I loved about this article was this proposal of micro practices for stress reduction. So sometimes when we think about the idea of self-care, it's like go home and take a bath or go on a vacation to your favorite island or whatever that looks like, but that's not going to be the most preventative, right? The most effective. Maybe once every 5 years, you'll get to go to your favorite vacation spot, and we can't wait that long, right? Our clients can't wait that long to get good care. So these are some recommendations that you can do kind of in the moment, real quick during the workday. Practice mindfulness or grounding while applying hand sanitizer. Since last March, I actually was not a believer in hand sanitizer. That's right, not a believer in hand sanitizer. I put it on probably like 7 times a day at minimum now, just to be sure. So that's 7 opportunities in a day for me to practice a little bit of a grounding moment, to check in with myself, focus on my breath, center my mind and body, visualize the presence, empathy, and calmness that I want to give to my next client, right? It's such a complicated topic because people a lot of times say those things like, oh, I just don't have the time, or I have so many other things on my plate. A lot of times self-care and therapy, for example, are those things that get put to the back burner because everything else is more important. But this, well, I'm here to tell you that it is one of the most important. But mostly I want to really drive home the message that self-care does not have to be this well planned out, island vacation or 35 minutes in the bathtub. It can be literally putting on hand sanitizer, right? So there is no excuse for not practicing it. Take that moment to self-connect. Get in tune with how hungry, hydrated, emotionally regulated, or dysregulated you might be. Better for you to do that between clients as you're putting on hand sanitizer and walking from your office door to the lobby to check in and say, wow, I'm like real cranky right now. To then take maybe 10 minutes, let your clients wait for 10 minutes, then to invite them in right away because you didn't notice, and then they say something like, I relapsed yesterday, and you fly off the handle. You know what I mean? Whether that be externally or internally. You have opportunities to prevent that. Oh, and I like this idea because I'm a self-identified control freak. When I feel out of control, recognizing the little pieces of time that I do have control is like quite grounding to me. So engage in diaphragmatic breathing. We tell clients to do this all the time, and sometimes or often we need to take our own advice. 10 minutes of diaphragmatic breathing can improve blood pressure. Identify other recurring events that can cue mindful check-ins, like maybe every time you log into Citrix, you do diaphragmatic breathing or a positive affirmation, or every time that you sign a note, or every time that you go to the restroom. Try to find these common occurrences that will invite you an opportunity to practice self-care, or at least a check-in. Stephanie Stevenson. Mm-hmm.
So, like for me, and it's also like really important to know what your self-care is, because you can sit here and tell me to breathe every time I sign a note. I already know that doesn't like work for me. I get like lost. I'm like, what am I doing? Whatever. But for me, what I found is I make sure that I pack like 5 snacks throughout my day. So then I'm like, oh shoot, why am I getting angry so easily? Oh, that's right, I need to eat something. So for me, it's like, oh, every time I go to the bathroom, whatever, I'm gonna stop.
Pop a couple almonds in the mouth.
Yeah.
Mm-hmm.
And then grab my next client and I'm good to go.
Yes, awesome. And that's so important that you take that time. That's what's most important, is to take the time to check in and notice. Right, and I like how you pointed out that one person's self-care strategy may not work for you. And that is really important to know for yourself. Remember that idea of self-efficacy and accomplishment. If you can accomplish going a week without feeling whatever symptoms of burnout you're used to feeling, that's going to be really rewarding for you and reinforce whatever practices you use that week. A little bit more on micro practices. Be active in acknowledging and labeling your emotions throughout the day, especially the challenging ones. Dan Siegel, our neuroscience guru, coined the concept of name it to tame it, right? And there are MRI research studies that say that it's really helpful for managing emotions. Practice gratitude. Janine also mentioned this. She said, or she didn't say, but a way to practice gratitude might be writing 3 things that you're grateful for throughout or at the end of the day. Using the 3 good things practice for 15 days facilitates positive benefits on burnout, happiness, depression, and work-life balance. Express gratitude to those working around you and with you. This is one of my favorite. It doesn't take hardly any effort. It's not something you have to really set aside any time to do. Not only does it help manufacture those like positive and desirable emotions in yourself, it reframes your mindset a little bit, but then also it helps our organizational climate and can foster co-regulation. So if Dara is having whatever kind of day, I don't even know, because I've just been in my office with my head in my own life all day. I might not know she's having a bad day, but I might say, I can so appreciate how many reports you churn out, Dara. You are so good at your job. Thank you so much for everything that you do. maybe I helped her day turn around a little bit, but I also allowed myself 15 seconds to be in a positive mindset. Mindfully express your experiences with others to normalize theirs, which might look like me going into Dara's office and saying, like, sometimes I just want to go home early and crawl into my bed because I feel so overwhelmed with the distresses of my clients. And she might be like, you feel that way too? Thought I was the only one. What can we do about this? You know? Don't be afraid to ask for a moment to collect yourself. Tracking your mood and tension levels is important, and so is doing something about them. The world can wait an extra moment for you to self-regulate before providing care. Really, in the long run, your clients would thank you for making them wait an extra 5 or 10 minutes in the waiting room than to just jump in when you're dysregulated, because who knows what you might contribute to their life, you know? So take that time to say, okay, no, I am cranky. I do need to have a snack, so I'm going to make sure that I do that, so that way I'm in a better space for my client. Be comfortable with saying I need a minute or I'll be there soon, both to clients and coworkers. I have a handful of slides on practical guidelines for self-care. What time do we end? 3:20? 3:30? Oh. Okay. Great, we have plenty of time. Let's see. I suppose what I'd prefer to do right now is ask if anybody has some wonderful self-care recommendations or strategies they use to prevent burnout or manage burnout when they notice that it has occurred, or compassion fatigue. Because I have a ton that we can go over, but I'd love to hear personal experiences. Yes?
I actually have a question. You talked earlier about like the stress cycle and completing it and how that was important. Could you talk more about that?
Yes. So the question was if I could review the stress cycle a little bit more thoroughly. So just like you can akin it to the trauma response, right? So there is a threat in front of me. This would be the first of 3 phases of the stress cycle. There is a threat in front of me. That could be a real threat, like a snake in the woods. We'll say a poisonous snake in the woods. Or it could be a perceived threat, a stick that looks like a poisonous snake in the woods. So in our workplace, a real threat might be getting called into your boss's office after you know you've done something naughty, right? It's happening. Okay. A perceived threat might be getting called into your boss's office on a regular Thursday afternoon and assuming it's because you did something naughty that you're going to get punished for. And then the second part of that cycle would be actually experiencing the stress in response to whatever that stressor was. So you can think of like the typical fight or flight response, whatever, when you notice that kind of like jump in anxiety, that jump in worry, that sinking feeling in your chest, the racing thoughts, right? Trying to problem solve, that's the experience of the stress. But then the third part to that cycle is after the event has occurred, recovering from it, recognizing we made it out alive. I probably still have my job, perhaps, you know, if it's just a Thursday afternoon and I got called into my boss's office and I didn't have anything naughty to be disciplined for. Recognizing like, oh, that was like an okay experience, and calming down and acknowledging that like resolution of the process. Does that make sense? Is there anything else you had to ask about that?
I mean, I guess are there other ways that you can help yourself, like feel resolved about it?
Mm-hmm. Yeah, so that's kind of a large part of what I want to get at here is we, I think, can so easily finish the workday in that step 2 of that 3-step process. And so by taking the time to gain insight into what our experiences, reactions, stress cycles are at work, whether it be client related or colleague related or boss related, not just stopping it right there, but taking the time to reflect on what happened. It was okay, this person disclosed this distressing event to me. I took it on for that moment. I let it go when the client left the office. Or if I didn't, now's an opportunity to let it go and say, okay, that was their heartbreaking experience, and I have so much empathy for them. And then doing whatever it is that works for you to leave it with the client, leave it in that space as much as possible. And if that's something that's really difficult to do kind of in your own time, engaging that support by talking through it with your supervisor or a trusted colleague, or going to therapy and talking through it with your therapist, so that way you can come to that resolution. So everybody's process might look a little bit different, but the goal would be for you to notice everything's okay, as opposed to internalizing it and holding it with you as if things aren't okay when they really are. Does that make sense? Okay. Anybody have some self-care strategies that particularly work for them? Yeah, sir.
So my name is Brian. I work at the Bridge team. I love this topic. It's something that I'm super passionate about. But a couple things that I do that I found worked really well for me was right when I'm done at work, I take my badge off. I have a different mask I wear. And I get my phone is on do not disturb, and I stick it in my backpack, so it's not even in my pocket. And I have a mode of I don't work here. As I'm
I don't know you.
Yeah, I don't know anyone here. I'm I just came here to use the bathroom. I'm leaving. But before I do that, I always have to write all of my notes. So any of my thoughts about things clients disclosed to me or things that I'm concerned about that I want to follow up on, I try and get those out of my head and onto paper so that I don't have to worry about writing it tomorrow or telling my supervisor about it tomorrow. I send an email the night of.
Yeah.
So that way when I transition out, I'm okay, cool. I don't
You
work
really
here.
don't have anything to hold on to.
Yeah.
And not only, I love everything that you said, but I also love that you kind of were killing 2 birds with one stone, because being late on your work, on your documentation stuff,
It's so stressful.
it's so stressful and will just contribute to your burnout and compassion fatigue. So yes, getting all of that out there at the end of the workday before you go home is a great physical manifestation of that release. Wonderful. I make a similar recommendation for that in terms of I don't know if it's on this slide, but writing a to-do list for the next day before you leave work, so that way it's not all on the top of your mind at the end of the day when you're at home or you're trying to remember, okay, I have to remember this for tomorrow, I have to remember this for tomorrow. What kind of release or detachment is that, right? Yes.
I love going on walks, so even if it's only for 20 minutes when I'll get home, and I use that time to listen to audiobooks, and I always joke that I don't listen to books that are going to make me a better person. I like to use that to just listen to my brain candy books. So just things that are entertaining, don't require any emotional investment from me, and I just go
Keeping
on
up with
a
the
walk.
Kardashians is my release.
But I just go on a walk and listen to my audiobooks, and it's a good time.
Yes, wonderful. I like that. I make a similar recommendation in terms of scheduling activities that are not work related and develop daily strategies for transitioning from life at work to life at home. And so sometimes people umbrella this under just the drive home, but there's too much going on when you're driving home. There's traffic, there's thinking about what you're going to cook for your family for dinner, there's whatever you have to do on the drive home. It's not the most sufficient, and so my encouragement is to try to take the drive home, but when you get home, have some sort of a routine. So perhaps yours is to get in different clothes and go for a walk. I have a whole routine. When I get home, I go upstairs and change clothes and check my phone, social media, wash my face, create some sort of ritual that the people in your home know is your ritual. So that way you set the boundary that it's uninterrupted time, and change out of work mode. Get into personal mode. Develop healthy habits of eating, sleeping, and exercising. Set appropriate boundaries for work-related activities, such as beginning and ending sessions on time. A personal feat for me. Limiting work-related phone calls or emails to specific times of the day or early evening. Attend trainings and workshops and read up on your ways to enhance your education on healthy workplace boundaries, like this or others. Diversify your work activities or caseload. If you are doing, oh my gosh, I work at a private practice as well, and one of my coworkers sees 50 therapy clients a week, and I don't understand it. And I'm like, when do you relax? When do you detach? I haven't gotten any answers yet, and so that is very, very. I can imagine that his propensity for compassion fatigue is quite high, because that is just one task all week, all day, every day. Yeah, I personally benefit from a little bit of diversity. Utilize personal psychotherapy as a means of addressing psychological distress and enhancing professional competence through increased self-awareness, self-monitoring, and emotional competence. Pursue treatment methods that are trauma, anxiety, or depression focused, such as mindfulness-based stress reduction, CBT, psychoeducation, other trauma-focused treatments. Write down your list of to-dos to avoid rumination. Use thought-stopping strategies if images or thoughts or feelings are frequent and intrusive at home. Attempt to identify your triggers. Attempt to identify the special meanings associated with triggers. By doing this, knowledge is power. So by understanding what your personal process is, you have more influence over it and can manage it better. Pamper, treat, or reward yourself. It is appropriate and you deserve it. And that might not mean, like I said, take a 45-minute bubble bath, that might mean that if that's something that works for you, but that might mean regularly getting your hair cut, getting new work clothes because you've needed them, but you've gone shopping for your kids' clothes because they keep growing and you haven't gotten any for yourself. Those kinds of activities are so important for us to feel like we're not falling behind. We're a version of ourselves that we feel comfortable being. Regularly use stress management and relaxation strategies. Increase your resilience. When I say resilience, I'm referring to your resources and coping strategies. MBSR training has led to positive effects on counseling skills and therapeutic relationships. Increase your social support. I love this fact. Adults who had multiple ACEs, the Adverse Childhood Experiences Study, adults who endorsed more than one, who also said that they had 3 or more supports in their lives, had less depression and even good or excellent mental health when compared to similar peers who did not have as many social supports. Attend to self-care vigilantly and prioritize your mental health. Part of my research in compassion fatigue actually came from when I was creating a psychoeducational group therapy program for the non-offending caregivers of children who have been traumatized. And this same research was applicable to those caregivers when they took care of their mental health and managed their reactions to their children's traumatic experiences. Their children actually had enhanced positive outcomes in terms of therapy. and overcoming the trauma. So we, as practitioners and providers of these services, can have that same influence on our clients, right? If we take care of ourselves, we're a better conduit for healing for them. Enhance your knowledge about compassion, fatigue, and treatment. Learn adaptive coping mechanisms and implement self-forgiveness to foster healthy behaviors, emotions, and thoughts in your clients. Something that I think is really important to point out is struggling doesn't make you bad. It doesn't make you a bad employee. It doesn't make you a bad therapist or social worker. It doesn't make you weak. Did I say weak? It doesn't make you weak. It doesn't make you less strong. It doesn't make you inferior. It doesn't make you weak. It doesn't mean anything bad about you, just that you are human working in a difficult job. And I think acknowledging that is a huge part of this process, because without acknowledging that, you won't seek the support that you need, and you won't do for yourself what you need. Seek spiritual support if that is what's helpful for you. Engage in your favorite exercise or try a new one. Be kind to yourself, practice self-compassion, recognize your experiences are normal and acceptable and yours. Remember that some things are outside of your control and nobody expects you to alleviate all of the suffering in your clients' lives. Remember that your emotional and physiological responses to individuals and situations are normal, understandable, and justifiable. And then when I was reflecting on our organizational assumptions and climate and resources, these are what came to mind in terms of what could help prevent or decrease burnout, like our benefits, right? So we get access to insurance that could give us access to therapy or other health care. We have our wellness program that diversifies our work experience, but also keeps us accountable to practicing healthy behaviors. We have our conference where we're able to be presented with information like this. We have a training stipend, and so perhaps some of your training stipend can go to trainings that you think would be helpful for you, not just helpful for the services you deliver to your clients, but on compassion, fatigue, or burnout, or prevention methods, or workplace boundaries. And then our HR surveys can be really a useful resource in terms of expressing our experiences, needs, and desires to the people who have some power over that stuff. Can anybody think of any other Wasatch behavioral health resources that might help us fight the good fight? I would say for me, the culture does a lot for that for me. Knowing that I can go really to anybody in my department and feel supported, to vent a little bit, or to work through something that's really difficult, or to inquire, or to just say I feel like the worst therapist today, for somebody to help me reframe that when I can't do it for myself. So I encourage you all to find some sort of workplace resource that is effective for you. That was my whole presentation. We have some time left for questions or any contributions that anybody might have in terms of their own experiences that have maybe been helpful or not helpful for them. I'm here for it. That works. Then we can call it a day. Thank you all so much.